Hey everybody, welcome to painwebinar.com, and I'm so excited that you clicked on the joint button because that means that most of you that have clicked on here have shoulder, elbow, wrist, or hip, knee, ankle issues, right? Otherwise you would have clicked on neck or back, and we've covered those. And the first thing that you may think when we talk about, if you've clicked on these different things, is that we talk about kind of the same thing. And it is. But it's the approach that we have to these different problems that makes us different. So when you're looking at joint issues, the treatment plans can be a little different, okay, versus a spine issue. We're still going to do a thorough consultation. In other words, I want to figure out not only if it's a knee problem, do I also have an ankle and a hip and a low back? What else do I have going on? And the reason is, if I just address the knee and I don't address the other issues, you're not going to fully heal and you're not going to resolve your problem, and it's going to flare up again. And that makes no sense, does it? So in our consultation, we want to evaluate all the different joints, all the different regions to find out exactly what's going on with your problem. And we're going to find out, is this because of a lifestyle issue, like working on concrete for 20 years, right? A chronic issue. Is it because of a trauma, like a sports injury? Or is it because of a car wreck, slip and fall, something like that? So that's where the consultation is. Once we gather enough information that warrants an exam, we move on to a functional exam. And a functional exam is we're going to put you in different motions to test different tissues and to test different aspects of the joint. That tells us where to go look. And if we have enough information there, it takes us down to the functional diagnostics. We're going to have you stand and take an x-ray. We're going to have you move and do an ultrasound. Those are functional diagnostics. And it's loading a joint and seeing how it responds to the stress of the load. We see this in stress tests with cardiac patients. The theory works well with the application. And that's what we do with joint pain, folks. We're going to stress the joint, see how it responds, and between the functional diagnostics and the functional exam, it tells us exactly what tissue is involved. The big difference is we're going to do a team approach. We're going to have medical doctors, nurse practitioners, chiropractors, and therapists come together around a table discussing your findings in an exam, your consultation, and your functional diagnostics. And each one of us has input into your care plan. And in doing so, you get multiple opinions for one cost. Who benefits? You do. And that's why we do it. And that's why it's called a team approach. Then we're going to come up with a functional treatment plan. Now, when you look at joints, joints wear out, and we want to be able to regenerate those joints and keep your own joints. And that's why when it comes to joint pain, regenerative medicine is the future of medicine. We can rehabilitate that joint, we can regrow and regenerate within the joint. Then we're going to add medical care, which may be some type of an injection to get you beyond a certain point. We may need bracing to support that, like on a knee. If we do regenerative medicine and then we support that on a knee with an unloading brace, great results. Then we need to rehab that joint. We need to stretch certain muscles and we need to strengthen other muscles in order to functionally stabilize the joint. And we don't just do that with one joint, we do it with the entire chain, meaning the entire extremity. If it's a low back, meaning knee issue, hip, we're going to strengthen from your waist down to stabilize. If it's a shoulder, elbow, we're going to strengthen from the neck out to stabilize that entire joint. And then we have chiropractic to restore normal biomechanics within a joint and make sure that we have the neurological integrity coming from the spine. When you stack all these things up, folks, who wins? You win. And the reason that you win is because you have a team approach with a team concept of treatments, and it'll get you better faster at a lower cost, and you get to keep your own joints. And that's why at Advocate Integrative Medicine, we do things differently by a team approach. So I want to give you an opportunity to come in and get a consultation and an exam at a reduced fee. To take advantage of this, you simply got to click below. Click below, make an appointment, tell them that you were on Pain Webinar, and we'll probably have that information when you do call. or if it's directly into our system. We're setting that up now. And in doing so, you can figure out, and we'll be able to tell you if our team approach is best for you. But folks, I guarantee it is, because where else are you going to get this cross-section of professionals that give you one fee for multiple opinions? You don't find it. So we are a team approach with a team concept of treatment, and you benefit. That's why we're different, and that's why I hope that you click on the link below and take advantage of this opportunity. I'm Dr. Dunne. I'm at Advocate Integrative Medicine, and we hope to see you soon.